Hello, my name is Dr. Eric Green. I'm the Internal Medicine Residency Program Director at Mercy Catholic Medical Center. In this video, we're going to discuss how we support our residents on their journey throughout the 3 years here at Mercy. At Mercy, our residents represent graduates of medical schools in 5 different continents, and we're always looking for Australians to make up a 6th. Some of our residents went straight from high school to college to medical school here in the Delaware Valley, and consider an exotic trip to Epcot in Walt Disney World and a stroll around the international pavilions. Others are Americans who have chosen to take medical school training outside the United States and are returning to the U.S. for residency. Yet others are international citizens who have grown up and gone to medical school outside of the U.S. and are coming here to learn more about U.S. medicine. Our residents represent a full swath of diversity by age, gender, prior experience. This diversity is on purpose. We firmly believe that diverse teams are the best teams, and that our residents learn as much from each other as they do from our faculty. At Mercy, we recognize that success is more than time spent on the floors. We make sure our residents have opportunities for greater enrichment, whether this is our annual Doctor's Day celebration, where we celebrate the achievements of the medical staff and the residents, or it is our welcoming and teamwork activities, such as our opening cruise that we traditionally held every summer, or whether it is a recognition that everyone learns differently and a commitment to providing electronic resources, including pre-purchasing ACP membership as well as MaxApp membership for all of our categorical residents. Or whether it is the importance of disseminating work beyond the walls of Mercy Catholic Medical Center. We offer travel reimbursement, once COVID is done of course, for residents who present both research and clinical vignettes at any major national meeting. We also recognize that at Mercy, there is more to our training than just classroom learning and service-based learning. We take advantage of our clinical learning environment and host special seminars in teamwork. We understand the importance of procedural skills and integrate simulation into our orientation as well as our day-to-day clinical learning environment. Finally, we recognize the importance of a structured didactic, and we have a daily noon conference, which we hope in the post-COVID era will return to an in-person format, although we are currently using virtual media to good success. Most importantly, at Mercy, residents are our primary focus. We do not sponsor fellowships here and do not have fellows. This means that all of the educational interactions are between residents and attendings. For example, at 2 in the morning, when you're trying to figure out whether a patient needs hemodialysis, the person you're speaking with is the board-certified nephrologist. That seems intimidating at first, but what you quickly learn is that the person you're speaking with is the person with the knowledge. It is the person who's going to teach you and make you successful. It means, for example, when you're walking around on a consult rotation, that all of the formal and informal interactions between the subspecialist and the resident is with the resident, not the fellow. We understand also that there are so many different diverse resources and so many different learning styles that we need to expand our learning beyond the bedside. So we have a number of different electronic resources which we use either fully remotely or in hybrid fashion. Our daily schedule is peppered with in-person seminars that focus in on specific issues, such as bioethics, which is really much more about the medical legal aspects of medicine than abstract ethical principles, or antibiotic stewardship, where we focus in on the most appropriate use of antibiotics on a broad swath of patients, not just those for which ID co-management was requested. In addition, our residents are expected to be teachers and spend time during their day teaching medical students from our medical student partners at Drexel University College of Medicine and Philadelphia College of Osteopathic Medicine. We also recognize that residents are here to learn and not to serve. As such, we have implemented a touch system which reduces patient load by resident according to where they are in a call cycle and where they are in a academic year. We understand that the farther you progress, the greater your capacity, but to expect an intern on day 1 to have the same skills as an intern on day 365 would be unrealistic. In addition, we recognize that resident workload is dictated by the number of patients they see during a day, not by the number of patients who may be arbitrarily on their census at a specific hour, and limit that total number to a reasonable number that will allow our residents time to learn as well as learn from our patients. We have an outstanding GME support staff which works tirelessly to make the work of our residents administratively seamless. It is their job to digest the complicated external regulatory requirements that are required to be a physician and to simplify them so that from the standpoint of the resident, they're simply coming in, completing forms, and signing their name and moving on. We have amazing opportunities to pursue electives outside of internal medicine, whether they be non-traditional medical electives like interventional cardiology, entirely outside of internal medicine like diagnostic radiology, or electives outside of our walls. And we do permit all of our categorical residents up to 1 4-week block of an away elective, which can be taken either in the greater Philadelphia area or anywhere that a resident finds an appropriate educational opportunity. We hope that you'll explore the rest of our website and learn more about the different aspects of our residency. Thanks so much for listening today.